News. I'm Akash Mistry, your host for the broadcast at CIO News. This is a recorded session and will be available on our website, cionews.co.in and CIO News LinkedIn handle. This is an exclusive fireside chat powered by Avaya on transformation through customer experience. Businesses are built by experiences they provide, and every day, millions of those experiences are delivered by Avaya. Avaya is shaping what's next for the future of work with innovation and partnership that deliver a game changing business benefit. So, let me introduce my guest for today, Mr. Nitin Shetty. He is the Chief Technical Officer at Bioneeds India Private Limited. Hello, sir. It's good to have you.
It's a pleasure for me to. Hi, everyone,
Thank you, sir.
and good evening to all.
To tell you more about Nitin, he a discovered scientist with over 30 years of industrial experience, about 21 years in leadership role. Now he is representing Bioneed India Private Limited as a leading Indian pro-clinic CRO as Chief Technical Officer and looking into multiverse operations. We also have Mr. Bhavesh Vora, Sales Engineering Leader at Avaya India South. To tell you more about him, he is a dynamic and result oriented professional with progressive leadership experience in enterprise, telecom, and IT industry. He has more than 20 years of working experience in various roles. Over to you, Mr. Bhavesh.
Yeah, thank you, Akash. Good evening, Mr. Nitin, once again. Thanks for joining us. So we have been doing these kind of things, I have personally done sessions with a lot of CIOs. I think after a long time, I'm doing with somebody who's not from the IT background. So it'll be really interesting. So what we do is we try to find out, trends, the strategies that companies use for, especially for customer service, the usage of digital channels, the way they provide customer service, and of course tools for employee productivity. That is the kind of theme, and I'll ask you a couple of questions
Sure.
based on that. So to start with, I did hear Akash introducing you, but if you can briefly elaborate more on your role within Bioneeds, and who do you define as your customer to start with?
Right. So, Bioneeds is a preclinical CRO where we offer services to discovery companies, pharmaceuticals, biotech companies, agrochemicals, and all the life science segments. And we have in place a lot of scientific models which are in sync with the regulatory requirements or something which are exploratory. And we cater to all these people who require either for marketing permission or permission to get into first in man studies. And the studies that is done over here is acceptable globally in all the regulatory places. That's what we do over here. So here we are in the business of studying science. That's what we do. And we have got different verticals to support those activities within the drug discovery space. And we also support data generation so that that can be taken up into the clinical trials. So that's what basically is what we do. And I am overseeing the operations from the scientific point of view and also from the administrative point of view over here.
That's great. Thank you. So I think from that, I mean, since you are managing the overall operations, so who do you define as a customer? Is it a retail customer? Is it B2B? You're creating a lot of scientific data, probably creating drugs, molecules, creating patents. So that gives us an idea how do you provide service to customers. If you could define who in your is a customer for you.
As I said,
Who?
we have to multiple segments within the market, the
Mhm.
pharmaceuticals, biotech. These are the customers.
Okay.
Basically,
Yeah, got it.
yeah, they are the ones who are looking into activities where they want to put up the proposal for ANDA submissions or for INDA submissions. So we generate data for them, and then in turn they submit that and get their required permissions to go ahead either for marketing or for market release or for the first in man studies. So primarily our customers are the different companies that I mentioned, reference companies that we mentioned.
Yeah, I understood that. So it is essentially a B2B kind of
More or less,
yeah,
yes.
more or less. Yeah, fine. So I think so. The way we structure this is, if you have to provide a customer service, with the various verticals that you mentioned, how is it that you provide? is it traditionally, it's just like physical meeting, or do you provide use of collaboration tools, or do you use digital channels, like email, web chat? How is it that you provide customer service in terms of usage of technology?
So from the uh, business point of view, how do we tap our clients? One is some of the clients who have started business with us right from the beginning when we were a very small company. It started as a one-room company, and now we have expanded into a 2 lakh square feet company over here. So they have helped, and the word of mouth. That's how it has gone through. And secondly, yes, we now have a team who do our exploration. They do cold calls to different clients from different regions, and based on the feedback that we get, we respond back on the technical aspects. And then obviously we have these road shows, conferences, webinars that we put across so that we can attract customers and show our capabilities, basically the scientific capability that we have. Obviously, we have to impress upon the infrastructure that we have, the regulatory certificate that we have, which makes the data acceptable to global regulatory agencies. So that's how we, look into the clients. Obviously, we have different segments of clients: the
Yes.
the moderate players, and also the venture capital funded companies. So we try with the venture capital because they are easy to be tapped, and then we start moving upwards. That's how we function from the business point of view.
Okay, so that is the way I think a business is. Okay. So you mentioned you're doing cold calling and all. So I mean, is the cold calling done from in-house, or it is outsourced cold calling, or yeah,
It is basically from in-house. We have a
in-house?
team who is basically into exploration. So they
Hmm.
keep on making those cold calls, and as and when we get a sort of a response to that, then they pass it on to the relevant respective business
Correct.
development.
Got it. Got it. Okay. So going forward, I mean, since we covered the first aspect, second aspect, which is common across all companies, how do you really measure customer experience? I mean, some customers use NPS, CSAT, and how do you actually capture? Is there a technology you use? You know, uh,
We
if you
have
can
got
little
something.
bit build on that. Yeah.
Yeah, we've got a software, something which is called as a project net. The
Mm.
project net has a repertoire of the customers that we are working and what are the projects that we are working with. And then based on the feedback that we get, it's all documented into the project net. And then we look into the feedbacks and we see how where improvements has to be done, what new capabilities that has to be built in. So that's a platform that we use over here.
So you send surveys to your customers, and they fill it up and they send it back.
There are two ways. One is we get it through the calls that because we have got a project management team over here. Once we
Mm.
complete, they touch base with the client and take a feedback. And in some cases, we send a form which they fill up and send it across. In 90% cases, the feedback that we get it through the project management.
Through the project management itself. Okay, I got it. That's good. So you mentioned, I think you create a lot of scientific data, and you also mentioned a platform for this project. Uh, I mean, are all these technologies on premise, from the IT perspective, or everything is hosted on the cloud? Is cloud adoption easy in your kind of a domain?
As of now, we have not got into cloud. We are into server-based activities because all the software and all that is built in for regulatory submissions, they're all into the servers, and through them we pass it on to the regulations. That's what we do. But yes,
Hmm.
going forward, we are looking into uh, getting into the cloud specifications also. But we are discussing with multiple clients, and we'll see how to move about with that. Because we have to see that it is in sync with the regulatory requirement also. Because
Yeah.
confidence is something which goes a long way. So we have to also ascertain to our client that how we are maintaining those documents or this data in a very confident manner.
Yes. Yes. So are there any regulatory standards, in India, as per your in your vertical, in your industry, that we
From
have to adhere
the
to when you have to
data
move to
point
cloud?
of
Yeah.
view, the submission part is there because we have got
Hmm.
something called as a send format. But
Hmm.
from the data storage, there is no regulatory. We have to
Hmm.
make our specifications.
So you have to just ensure data is protected. That is important.
That is correct.
And there is a body which regulates all this, or it is just for customer comfort?
No, no body, because there's a regulatory body from the scientific point of view, but
Scientific body. Hmm.
not for the data management.
I got it. Thank you. I think we touched upon this part also. Now, I think now increasingly, now again, this is a generic question. There is a lot of use of analytics, you know, and if you see, if I go to the IT domain again, there is digital transformation happening. There is a use of artificial intelligence in some of the processes. I know you are creating a lot of data. So, are any of these digital transformation tools being adopted in your company? Are you using them in some way, or are they planning to use?
See, whenever we are working on a project, there are
Mm,
multiple scientific verticals that comes into place. One is
mm,
because we are working a lot with the animals over here, because there's a preclinical activity before the clinical. But then we have a lot of tools, the instruments. The instruments has the one that generates the data. There we interlink the instruments to the different protocols that we have, and for that we have different platforms where each instrument has this handshaking with each other, collect the
mm.
data, generate the data, and then summarize it statistically, and then present it in a manner. And also, these data has to be stored for over 15 to 20 years. So that again, that instrument is directly linked to the server to the limbs. That's a process that we have over here.
Okay, okay. So a lot of data is being generated and stored on premise. So these trials you do only on animals, not on human beings.
Yeah, that's why we call ourselves a
Yeah,
preclinical.
preclinical trials.
Before
Okay,
going into clinical, there has to be data generated in animals to say that it is safe to be used in humans, and then it goes into.
okay, okay. So there you use various tools like IoT data from whatever the trials which are going on and store it. There must be a huge, enormous amount of data, which you provide to those companies that you provide. That you say. Now I linked it. Sorry, I think it took a little bit of time for me. I got it. Yes.
Equipment like LCMSs, HPLCs,
Hmm.
those are the equipment which help us in generating that data.
Yeah, yeah. Okay, I mean it's a basically clinical process, and so there is no automation and all. You have to do the trials, get the data, and then share it.
There is
Okay,
automation.
you do
Everything
it
is
automatic through sensors and all that you mentioned. Yeah.
through instruments, through different softwares, to different platforms. So we have very minimal. Yes, obviously the animals cannot be automated, but the
Yes, of
data
course.
that get generated is put into the
Hmm.
different softwares, and then it's taken forward from there.
Very interesting. No, I understood. I got it. So I mean, one more question. I think last 2 years has been pandemic. You know, while most of the people work to the office. In your case, you go to your office, labs. Uh, this has been a challenging time. I know most pharma companies were open even during the pandemic. So how was it for you? I mean, employees working from home or going to office? How have you been managing it? Now, of course, we are over, but how was it for the last 2 years?
We are in a business where the testing is important, because the moment we do testing, the batch gets released into the market. So we
Hmm.
were considered as COVID warriors, and during that period, we were lucky to get a project on the COVID vaccine itself. So,
Hmm.
but the majority of the people were working on that vaccine. So maybe 60%, 70% of the people were allowed to attend work during those periods, because we have to be there in the lab to release certain medicines that goes
True.
into the. So that we were lucky. So we were functional, fully functional. Obviously, we had to take care of the people. We had some challenges there. So people used to call
Hmm.
sick and all, but then we had managed that whole scenario. It was a challenging phase, but I think we could overcome that. Luckily, we were in a space where we had to be in the lab, and the government recognized that part.
Yeah, definitely. Your kind of business you cannot do remotely. But supposing somebody is monitoring from home, maybe he's not going. You have the tools and stuff, you can actually monitor the lab from home, or you have to physically go to the lab.
That's hardly 10% monitoring can be done, basically for only for the
Mm.
equipment. But when we
Yeah.
have to look at the behavior of the animals and all, people have to be physically there in the
Mm.
labs. So 85% of the thing can be done only when we are in the labs. It
True.
cannot be
True.
done. Obviously, the business development, project management, the finance, they used to work remotely. So they had
Mm.
that. We don't have that luxury, so we had to be
That's true. That's true.
on
So
site.
there was a, yeah, the way we are using this kind of conferencing solution.
Mhm.
Are your employees within your company using some kind of a collaboration platform,
Uh,
to collaborate regularly, even during the pandemic and even post pandemic?
yeah, obviously we use the Teams a lot over here.
Okay.
We
Okay.
started with Zoom, but then we saw that that's not as secure. Then we migrated into Teams. So this is basically to interact with the clients,
Yes.
telling because most of the clients, basically when a project starts, they usually visit the site to see how the work goes
Mm.
on. But during the pandemic and all, we stopped all those things. So then this was happening to virtual
Mm.
meetings,
Yes.
especially the things that we used as a platform.
Yeah. Yeah. I think the customer facing teams and your back office, the people non-medical or non-clinical staff have been using these tools a lot. Yeah.
That's correct. That's correct.
Right. So I think that's good. I think I have covered most of the questions and from the customer experience and the employee experience perspective. I really don't want to go into the employee productivity and all. I think that is fine. Anything else you want to add, Mr. Nitin, or I'll just summarize? Yeah.
I think good to know this is a different kind of business that we are in.
Yes.
I have not heard much about this, but not many people do. But we are the people who work from the back end. You have those medicines coming out. You have a lot of things
Yes.
coming. But the major work that is done by the people with us. We identify the medicines, we give shape to it, and that's released into the market. And then obviously the companies uh, get the credit for bringing it to market. But the work that has been done behind it, I'll tell you, for each drug that goes into the market, it takes about 11 to 15 years of work for one drug to come into the market,
Yeah.
and takes about multiple man hours. And obviously, to that, they have these proprietary rights were built in for 23 years and 25 years. There's a huge amount of work, and to maintain that rights, we have to bring in new, different dynamics so that proprietary life can be extended further. So these are things that we work, and good that through this platform I could, make our presence felt. The
Yeah,
pre
no, no. In fact, there's a good learning for me. This is first time I have heard something about this. Preclinical trial. I've never interacted with somebody about that. So that is definitely learning about for me as well.
So without preclinical, the clinical cannot start. That's how.
Ah, that's true. That's true. So I think, I mean, if I just summarize quickly, I mean, very well, I think you create a lot of scientific data doing these preclinical trials, and you provide it to different verticals. Okay, I mean, you mentioned that there is a good outbound process. You do, people do cold calling as well. A lot of stuff happens maybe directly also. You may be having direct relationship with most of the customers as well. You most of the surveys done through project management, and you also fill up surveys using 10% of the surveys happen through filling up forms, but most of it is project management.
That's
I think a good amount of automation in terms of the clinical part of it, but not the I've not seen, maybe you may do something in the future in the other business processes, but clinical part there is a lot of automation, as you rightly mentioned.
in fact,
And I think
uh, IT started. There was a huge, discussion, and in fact, the jargon of IT BT marriage. Obviously, the
uh,
marriage happened, but they are still living partners throughout.
yeah, that's good. And I think you may also mentioned, touched upon that. I think currently everything is on premise, but there is definitely a plan to move to cloud by keeping all those data protection standards in place.
That's right.
Right.
That's
I think, thank you. I think that was a very good insight for me as well. Thank you very much, Mr. Nitin. Over to you,
pleasure.
Akash. Yeah.
Thank you, Mr. Bhavesh. Thank you so much, Mr. Nitin, for your valuable time and input. It was a great learning about some other dimension in the market. And thank you, Mr. Bhavesh, again